The purpose of this video is a comprehensive review of the most common sexually transmitted diseases afflicting America's adolescents and young adults. During the video, we will discuss signs and symptoms, prevention methods, and treatment options. According to the Centers for Disease Control, human papillomavirus is the most common STI in the United States. In fact, it is so prevalent and has so many strains, 200 and counting, that nearly all sexually active men and women get it at some point in their lives. Many strains of the virus can cause serious health problems such as genital warts and even cancer. Most people do not know that they are infected until they have developed one of the secondary characteristics of the disease, such as genital warts, or during a well woman exam by receiving an abnormal pap smear result. There are no specific tests for HPV as well, so knowing that you have the disease and protecting others from getting it can be very difficult. Some strains of HPV do not cause any symptoms, and some may even go away on their own. However, the ones that do not go away on their own may leave the individual with disfiguring genital warts or even worse, cause cancer. Genital warts may appear as small or large bumps that are in clusters or may appear individually. Unfortunately, the cancers caused by HPV include cervical, vaginal, penile, and even throat cancer, do not have many hallmark symptoms. Diagnosis is usually made well into the late stages of these cancers and are very difficult to treat. The only way to truly prevent the spread of HPV is by abstaining from sexual contact. However, barrier methods have also been very reliable in preventing the spread of the disease when used consistently and properly. Additionally, there are 2 vaccines that protect against 4 of the most common strains known to cause cancer and genital warts, strains 6, 11, 16, and 18. The vaccines are given in a series of 3 shots. The first, then 2 months later you can receive the second shot, and 4 months after that you can return for your third shot. All in all, it takes 6 months to become vaccinated. However, these vaccinations do not cover the whole cascade of all 200 strains, so barrier methods should still be utilized to prevent complications from the additional strains of the virus. Treatment options include cryotherapy and Aldera cream. The wart is chemically burned from the skin. Unfortunately, this process can be painful, leave scars, and may not prevent recurrence. In the LEAP procedure, the affected portion can be cut away to reduce any chances of precancerous lesions turning into cancer. If HPV is allowed to progress into cancer, removal of the tissues affected, oftentimes the uterus, will be removed in cases of cervical cancer, and radiation therapy are the only treatment options available but aren't always successful. Prevention is still deemed the best treatment option as of yet.
Chlamydia is a gram-negative intracellular bacterium and is the most common STD in the United States. Signs and symptoms in women are abnormal vaginal discharge, white, clear in color, a burning sensation while urinating, pelvic pain, bleeding, and swelling. In men, they will have abnormal discharge that is also white and clear in color, with a burning sensation while urinating and pain and swelling. Chlamydia is spread through vaginal, anal, or oral sex with someone who is infected. Prevention: abstinence, condoms, and monogamy. Treatment options include one of these antibiotic therapies. Gonorrhea is the second most common STI in the United States. It is a gram-negative bacterium. Those infected may be asymptomatic during incubation period. Women will usually have pain and burning while urinating, vaginal discharge, and vaginal bleeding. Men will usually complain of burning, a white, green, yellow discharge, and painful or swollen testicles. Gonorrhea is spread through vaginal, anal, or oral sex with someone who is infected and can also infect the eyes. Gonorrhea is usually treated with a course of 1 or more of these medications. Prevention: gonorrhea can be prevented with abstinence, condoms, or monogamy. If left untreated, it can cause a person to become sterile.
Genital herpes is a sexually transmitted disease caused by the herpes simplex virus type 1 or type 2. The CDC estimates that annually 776,000 people in the United States get new herpes infections. Estimated that 15.5% of people between the ages of 14 through 49 have herpes. Herpes is more common in women than in men. However, it is more easily transmitted from man to woman. Genital herpes causes painful genital ulcers in many adults that can be severe in persons with suppressed immune systems, such as HIV-infected persons. Both herpes type 1 and type 2 can also cause rare but serious complications such as blindness, encephalitis, which is also inflammation of the brain, and aseptic meningitis, or inflammation of the linings of the brain. Most individuals infected with herpes type 1 or type 2 don't show any signs and symptoms of the disease, or have very mild symptoms that are mistaken for another skin condition. When symptoms do occur, they typically appear as one or more vesicles on or around the genitals, rectum, or mouth. These vesicles break and leave painful ulcers that can take 2 to 4 weeks to heal. Experiencing these symptoms is referred to as having an outbreak. During the first few outbreaks, you may experience fever, body ache, swollen lymph nodes, and headache. The only way to prevent herpes is the correct and consistent use of latex condoms to reduce the risk of genital herpes. There is no cure for herpes. Antiviral medications can, however, prevent or shorten outbreaks during the period of time the person takes the medication. However, outbreaks can occur in areas that are not covered by a condom. The surest way to avoid transmission of sexually transmitted diseases, including genital herpes, is to abstain from sexual contact, or to be in a long-term mutually monogamous relationship with a partner who has been tested and is known to be uninfected. Persons with herpes should abstain from sexual activity with partners when sores or other symptoms of herpes are present. It is important to know that even if a person does not have any symptoms, he or she can still infect sex partners.